Hello, everyone. My name is Michael Stewart. I am Professor and Chairman Emeritus of Ophthalmology and also the Knights Templar Eye Foundation, Inc. Professor of Ophthalmology Research. I'm at the Mayo Clinic in Jacksonville, Florida. And the manuscript that my fellow authors and I have recently published in Mayo Clinic Proceedings, Innovations, Quality, and Outcomes is entitled Recent Updates on the Diagnosis and Management of Age-Related Macular Degeneration. This is a manuscript that looks at macular degeneration as a review article, but also looks at issues that are of importance to patients and especially to primary care physicians. We've gone through the literature and we've looked at those issues that predispose patients to the development of macular degeneration, and we've highlighted some of the important issues for primary care physicians, such as management of risk factors, listening to patients, and determining symptoms that require further evaluation and referrals to ophthalmologists. What we're interested in doing is making sure that patients have their risk factors addressed and that there's no delay for diagnosis, because we know that in macular degeneration, particularly wet or neovascular age-related macular degeneration, that early diagnosis, prompt referral, and early initiation of treatment gives patients the best opportunity at a meaningful long-term outcome with maintenance of vision and optimization of visual function. So how does this relate to practice? Well, we encourage physicians to talk to their patients and understand those patients with a family history or a personal history of macular degeneration and listen to what they're telling us in terms of their visual symptoms. What we're looking at is trying to get the patients to be treated effectively, and the treatment for most of these patients is going to involve the treatment of intravitreal injections of drugs that antagonize the actions of vascular endothelial growth factor. By giving patients regular injections, we're looking at trying to maintain visual acuity for an extended period of time. We also talk about the treatment of dry age-related macular degeneration, otherwise known as geographic atrophy. And we go through the positives and negatives of the drugs that are currently available and the controversies regarding their use. So in the future, what we're looking at is further drug development, particularly for long-term drugs that treat neovascular age-related macular degeneration at 6 months or yearly basis and does not require patients to return to clinic quite as often. We're also looking at new development of drugs that treat geographic atrophy in a manner that not only reduces progression of disease, but also limits vision loss. So thank you very much for listening to me, and my authors and I hope that you'll take time out to read our article, which has recently been published in the Mayo Clinic Proceedings, Innovations, Quality, and Outcomes.